So herewith we will be dealing with the normal body alignment and activities. Here basically we are focusing on the major positions. So the basic characteristics that we have to be maintained while taking a particular position, like either sitting, lying, or if the patient is standing. Okay. So before providing a particular position to our patients, so some of the assessment aspects we have to done, and it is having certain objectives like determining normal physiological changes in body alignment resulting from growth and development for each patient. So in some patients it may vary from the childhood and up to the adulthood. There may be several kind of developmental changes that may happen to each individual, irrespective of their age group. So many of them have some of the disease conditions like poliomyelitis, etc. So that may affect their body language. Then we have to identify the deviations in body alignment caused by incorrect posture. Then providing opportunities for patient to observe their posture, identifying learning needs of the patient for maintaining correct body alignment, and identifying trauma, muscle damage, or nerve dysfunction, obtaining information concerning other factors that contribute to incorrect alignment such as fatigue, malnutrition, and psychological problems. Then, when assessing the body alignment of an immobilized or unconscious patient, remove pillows and positioning supports from the bed and place the patient in the supine position. This point is very important because while doing the procedure in the practicals, this thing we have to keep in mind. So, before moving in detail, these all are the objectives for the assessment while positioning the client with any problems related to mobility. Okay. Now we can see each position and what are the basic characteristics that we have to focus while providing such position. So if a patient is, we are providing a standing position to a patient, there is some of the characteristics for maintaining correct body alignment while standing. So the patient's back should be straight and the feet should be firm on the ground about 4 to 6 inches apart to give an adequate base of support. So in initial classes, we have studied the principles of body mechanics. In that we have studied the need of wide base of support. So for that we have to apart our feet. Okay, with the toes pointing straight ahead or slightly turned out. Head and rib cage held high. Chin, abdomen, and buttocks pulled in. This is the normal posture while we are standing. The knees slightly bent. The arms hang comfortably at the sides. So, when a patient is standing like this, if we are observing laterally, the abdomen is comfortably tucked in and the knees and ankles are slightly flexed. The person appears comfortable and does not seem conscious of the flexion of knees or ankle. That is an unconscious part. That is the flexion of knees and even the angles that will not be in a conscious part of patient's mind. Then, if we are viewing the patient from behind, the center of gravity is in the midline, and the line of gravity is from the middle of the forehead to midpoint between the feet. Laterally, the line of gravity runs vertically from the middle of the skull to the posterior third of the foot. So if you are observing this picture is well explaining the anterior view as well as the lateral view of a patient who is in standing position. So we have to identify where the center of gravity line passes through and how a patient or a person have to be stand in proper posture with good or the normal body alignment. Okay. Now in sitting position. While in sitting, characteristics of the correct alignment of sitting include head is erect and the neck and vertebral column are in straight alignment. So it should be in straight line. The body weight is distributed evenly on the buttocks and thighs but not on the base of the spine. Weight bearing should be equally divided into both buttocks as well as the thighs. The thighs are parallel and in horizontal plane. Both feet are supported on the floor and the ankles are flexed comfortably. With patients of short stature, use a footstool or the footstep to ensure that ankles are flexed comfortably. That is, while sitting, we have to keep such things like back should be straight and legs should be kept very comfortably. The sole should touch the ground. Ankle should be flexed, and these things and arms should be kept on the thighs. This is a normal posture for suppose posture for sitting. And a 2.5 to 5 centimeter space is maintained between the edge of the seat and the popliteal space on the posterior surface of the knee. This space ensures that there is no pressure on the popliteal artery or nerve to decrease circulation or impair nerve function. So in this picture we can see there is a gap between the edge of the seat as well as the knee or the popliteal fossa. Okay, so this is to prevent the nerve dysfunction or the compression to the popliteal arteries and popliteal artery and popliteal nerve. So we have to maintain a particular distance. We can prevent nerve as well as circulatory dysfunction. Okay. The patient's forearm are supported on the armrest in the lap or on a table in front of a chair. So in this picture, we can see the arms are kept comfortably on the lap of the patient. So sometimes we can use cardiac table. I hope you may see cardiac table in our foundation lab as well as in the classes of comfortable devices. And all. So that also can be used by the patient for sitting comfortably in the chair. Okay. Now, the third one, that is lying position. So in lying position, the head should be in midline with the trunk. So the head as well as the trunk should be in the midline. Back should be straight. Back should be straight. Normal body curves like cervical, thoracic, and lumbar curves should be maintained. So in the previous class, we have seen some of the spine disalignment issues like lordosis, kyphosis. So in such cases, these curves are not maintained normally. So these should be maintained normally, and the ribs should be elevated to prevent constriction of the chest. Otherwise, what happens means the chest expansion will not be possible uh, for normal way. Okay, arms and legs should be in a position of functioning. That is the position for maximum usefulness of the joints, feet, and hands. This should be maintained. So while lying, not only for a patient, even though in normal person, individual also, this should be the normal lying position. So this is the comfortable way of. Okay. Now, so these all are we have seen the different basic three positions that we have to keeping in mind some of the characteristics or the basics that we have to do while assisting for a patient to either sitting or lying or standing position. So these much characteristics we have to keeping in mind. Okay.